Hi, Facebook Live. Welcome. Coming to you from Thomas Scientific at our home offices today. If you're not familiar with Thomas Scientific, we are the third largest, fastest growing scientific distribution company. We are supporting labs pretty much all over the world, specifically here in the US, supporting a lot of the COVID-19 facilities, and then also supporting facilities looking to bring employees back to work, schools back to work. So Vanessa, will you give us a welcome to National Safety Month?
Hi, everybody. Thanks for joining us here in the middle of the day. Typically, June is National Safety Month, and when we look at that in the workspace, we're normally looking at hard hats and hand railings and different ways to protect employees from personal injury. But as you're well aware, we are in different times, and what we're looking at now to protect and what's on the forefront for us as a priority is how to protect the health of you as an individual, as the employees of your company, and then it goes even further because we're also concerned about your employees going home and then protecting their family back home too. So National Safety Month is in June, and typically it's handled that way, but as we're moving forward, as states are reopening, as people are trying to get back to work, it's really important that we are protecting the health of our employees in a way that we are not accustomed to doing. And so we're here today to bring up some kind of best practices and give you some ideas. And we know it's not always fun to talk about the coronavirus, and so we are going to do our best to be in this with you and bring you up to speed on some implementations that you can do going forward.
Gosh, I feel like the last 4 months have been Safety Month. Everyone's been talking about it. But today, here's what we're going to talk about. We're going to talk again about how COVID-19 spreads, how to prevent the spread of COVID-19. What's the difference between cleaning, sanitizing, disinfecting? We've heard those words all over the news and those big buzzwords. We're going to talk a little bit about that. And then we're also going to talk about how to get your workplace ready for reopening. Do you have a plan in place? Do you have a COVID response team? Are they developing a plan? Are they in an implementation process? And what does it look like to maintain and revise that plan? So today we have Vanessa with us. She comes from Thomas Scientific Controlled Environments. She has 6 years of experience in clean manufacturing environments, medical device, pharmaceutical, aerospace. She has some really cool customers. So she brings a lot of knowledge to the table. She does have a communication degree from Long Beach State University. So give her a shout out if you went to school there.
And I'm joined by Jennifer Lee. She comes to us out of Colorado University, and she holds a degree in chemical and biological engineering. And Jennifer is a big asset to Thomas because she's walked the walk. She comes from 5 years of bench experience in pharmaceutical development and molecular diagnostics, which is very important right now in academic research. So she feels the day-to-day of a lot of what you guys are going through and getting back to the bench. So we're happy that she's with us. Okay, how does it spread? We do treat it similarly to the way of the flu. Please keep in mind, and in this I know that we've had to have probably more patience with information than we're accustomed to having, so always refer to the CDC or the World Health Organization to try to get your information. It does change, and as we learn more and try to understand more about it. So the idea is very simple. An infected person, anytime that you sneeze or cough or you exhale, the fluids in your body are being released into the air in droplets, and the droplets can fall onto the surfaces, and then people can touch the surfaces, and then if you touch your eyes or your nose or your mouth, then you can become infected with it also. And there is a possibility that this floats in the air for a while, and so you can get through it through the air. A lot of studies are saying that people touch their face on average anywhere from 20 to 40 times in 1 hour. And so I think we're all starting to become very aware of some of these little habits that we had and how to take our hands down, get away from our eyes and our nose and our mouth, And it's just really important to be aware of surface touching and how we touch our face. So how do we prevent it, right? That's the whole goal of what we've been doing as a country, what we've been doing globally and as individuals in our own household. So we really need to keep things clean and hygienic. And hand washing has made a big comeback this year. It is all the rage. Everybody is singing the happy birthday song 50 times a day, trying to make sure that you're washing your hands for a full 20 seconds. And so that's the best thing that we can do to get the germs off, is regular and thorough hand washing. The other part to the side of that is also hand sanitizing throughout the day when a sink and soap are not available to you. And the new thing is respiratory hygiene. Good grief, what on earth is respiratory hygiene? And this comes to the way that you would be using a mask to keep your own fluids inside of you and not spread them out onto other people. And then if somebody has, it's really just being very cognizant. Allergy season is rampant. If someone is sneezing, we can't just dismiss that it's allergies. You have to treat it really seriously and send somebody home, even if that's the case, until we get a better grip on what's going on here. And then anybody with a little cough, a low fever, it's just very important to address it as extremely serious. And then to keep in mind that if you're somebody who regularly takes ibuprofen or aspirin, these can mask a lot of the symptoms, and you might be missing some of the feelings that you're having, and then you're going to work and then it's spreading and we didn't mean for it to spread. So reducing the risk. Great news, it's summertime. And the warmer temperatures do help to reduce the time the virus can stay on a surface. And we need to be seeing a lot of cleaning, and disinfecting. And we will go over more on what that looks like. And so we're trying to be in this together as much as possible. So we don't want anybody to stock up on their disinfectants, but it's very important that you have a plan and you have a strategy and you have the products that you need. So when your customers when your customers are coming in, when visitors are coming in, when your employees are coming back, that you have what they need to feel safe and to kill the germs. And then anything that we can do to practice social distancing, so staying 6 feet away, switching up where the desks are, utilizing different areas in your facility that hadn't been used before, that would be another thing to really work on it, staying away from people to stop the spread. Clean, sanitize, or disinfect. Okay, cleaning is when you remove the debris or you remove the particles that are on something. Sanitizing does lower the number of germs, and disinfecting almost completely kills. So what's the difference? Really, sanitizing is kind of that middle ground. If you don't have a disinfectant and you have a sanitizer, sure, go for it. But think of it like this. If you have a cereal bowl and you feed your dog in the cereal bowl, and then you rinse the cereal bowl out with your sponge, do you want to eat your cereal in the dog bowl? That's when you want to sanitize and disinfect. I'm a cat person myself, so I would definitely not be eating out of a dog bowl ever, but that's just kind of the way to think of it. You took it off, but did you really kill the germs? Is it really safe for a clean environment to go forward knowing that you've killed off any kind of virus that could be there? So between sanitizing and disinfecting, as far as the EPA is concerned, sanitizing will kill bacteria, but disinfecting will kill bacteria and viruses. And so with the climate that we're in, it's very important to do disinfecting and not just to sanitize or to clean. We really want them hand in hand, cleaning and disinfecting.
Wow, that's some great information. Those are definitely some things that I didn't know. So I'm hopeful that our Facebook Live audience has learned the difference between cleaning, sanitizing, and disinfecting. So now I'm going to talk about what it looks like to develop a plan for your company, for your employees, and other people to visit your facility. So determine what needs to be cleaned. Do you have outdoor picnic areas? Those probably need to be cleaned differently. If your facility has been closed for 7 days and no one's been in there, it might not need to be completely disinfected. you need to have a team kind of evaluating that. If I was running a company, I would have a COVID response team. This would probably include your health and safety officer, as well as a few other people. And if you want to be on that team, let your company know. If you have a few ideas that you want to see your company implement, I encourage you to share that. We all have some really good ideas, and sharing knowledge right now is what we all need. So determine what needs to be cleaned, determine what needs to be disinfected. Your hard surfaces, your handles in and out, countertops, and then what are hard surface versus your soft and porous surfaces? You know, when I visit a place, I see these nice area rugs in the entryway, and they're soft and porous, but they might not be as easy to clean. So while we're in this pandemic, you may want to take those rugs out and just have your hard tile floor that's really easy to clean. And know that it's temporary, and eventually someday you'll be able to bring those pretty rugs back into your entryway. But look at things like that and consider it. And then consider the resources and equipment you need. Are you going to be using these single-use cleaning wipes? Are you going to have buckets of bleach that you're going to be cleaning things with? And that's for your COVID response team to develop for your company and your facility. So things to consider, I consider 3 different groups of people. Your essential daily staff, and what are they going to be required to wear? Are they going to be required to have reusable masks? Are there going to be staggered shifts? And I encourage you to talk with your employees or have that open door. You may have some employees that say, if I could come in and work 5 a.m. to whatever, take the afternoon off, be able to go social distance, go on a hike, go kayaking, whatever it is, you may have people that voluntarily sign up to come in at 5 a.m., which is not me. And you may have other employees that say, I want to beat the heat, go for a hike in the morning, and then come into work. I suggest being flexible with your employees in that, and trying to stagger those shifts. Some of those things I've seen universities start to do is to develop the idea of cohorts. So there's going to be a cohort that goes from class to class to class to class together versus intermixing all of their classes. So will you do that in the office? Will you have a cohort of employees that show up on specific days at specific times to really reduce that cross-contamination? And then the second people I think about visiting your facility are going to be your visitors. They're going to be your sales rep, like Vanessa and I, we're your sales reps. But what does it look like when they visit your facility? It might be a little different. If I was running a facility, I would have a protocol. You know, does that hand sanitize? They have to put on a mask if they're not already wearing one. And then maybe they have to sanitize and wipe everything down that's with them. And then if I was running a company, I might also have them wear gloves, because when you're wearing gloves, I feel like you're less likely to touch. And maybe that will help prevent the spread. That's up to you. That's up to your office to see what you think is appropriate and what's not. Again, what does the check-in process look like? Are they checking in on a kiosk and touching everything, or signing in with a pen? Is that pen being cleaned before it? Really kind of consider all those things. And then what's going to be required for facilities, maintenance, janitorial staff. And this might be where you do get pushback because they are maybe doing some heavy lifting, and wearing masks are hot and uncomfortable and you can't breathe and all of those things. How are you going to help address that in your, and make sure that it is safe for your company? And then what else? You're going to consider what needs to be routinely disinfected. And I think we've all kind of, your doorknobs, I think that's the number one we all think about. Light switches, countertops, handles, desks, you name it. What does that look like? When you're developing this plan, are you going to have someone assigned to disinfecting all of those things? Are they going to disinfect it at 10 o'clock, noon, 2 o'clock? Are they going to disinfect it more frequently, less frequently? And I think you're going to have some flexibility. So right now they may disinfect it every 30 minutes. a few weeks from now, if things aren't as risky, you can reevaluate that. And then you're going to implement your plan. So clean, dry surfaces, you're going to clean, disinfect, or sanitize, depending on what the surface is. Use appropriate cleaning and disinfectant products. Make sure you're not mixing them. So read those labels. Don't mix your bleach and alcohol. You know, you may think mixing those, you get double the clean. Let's not do that. So make sure you follow the directions on the label. And then, so steps for your disinfectant use. Vanessa and I are both here in California. We have a lot of regulations from the EPA about what you can and can't use. So check the product label. Is it EPA approved? Double check that. Right now, there are a lot of things hitting the market. So just do your due diligence and check that. Make sure you do read the directions. Like I said, don't mix them. Pre-clean any surfaces. If you see dirt, clean it off. Follow the contact time. I think that's a big thing that has been overlooked as you read those directions. It may say let this sit for 10 minutes so that it sits there and kills everything for 10 minutes. I think, like all of us, we want a microwave society where we can just spray it and wipe it off and it's clean. But we're singing happy birthday now, washing our hands. Make sure you wait 10 minutes when you're, or whatever the contact time is for that disinfectant. Wear your gloves and wash your hands. I wear gloves anyways. Some of these disinfectants can be harsh, and our hands are already going through the ringer washing them all the time. So wear some gloves just to give your hands a little bit of a break, and then lock it up. What does this mean, lock it up? That means a lot of these disinfectants are harmful to children, so you don't want children getting into them. It also means you have probably planned out how much you're going to need, when you're going to need it. If you have any employees that say, I don't have disinfecting wipes at my house, work probably won't miss them. Work might miss them. So I suggest you lock them up. Otherwise, they might disappear. So lock it up. And then maintain your plan. Continue with this. I suggest you stay flexible. And I think we're all learning what it means to be flexible right now. What you're doing today might be different than what you're doing 3 weeks from now. And so continue to just maintain it and update it. If your COVID response team is meeting daily right now, maybe they can meet weekly going forward, different things like that. And then anything you can do to reduce the potential of exposure. Here's a quick checklist, and we're going to talk more about a lot of these items. Masks, we're going to talk about those. There's a lot of controversy right now, but I hope you learned something about masks coming up. Hand sanitizer, disinfecting wipes, temperature monitoring. Are you going to require or suggest that your employees, anyone entering your building, is screened for their temperature? And then you're going to look at dispensers. Thomas Scientific has a really unique product, this Back to Work kit. And it kind of is something that you can hand your employees. Say, welcome back. We want you to be safe. Here are some essential things that we anticipate you needing to be safe in the workplace. Then we have carts that can have all of these supplies on them. Sterilization cabinets, you probably don't know much about. They have UV radiation, which kind of like in the sun, how it'll break down the viruses. And so you can put phones, computers, keys, whatever it is, you can put them in these sterilization cabinets. The UV will break down those viruses and help you have a safe items. Social distancing, whether that's your screens or signs, whatever it is, and your preventative safety. So I want to talk about face masks. Everyone's talking about face masks, right? So we're going to talk about them too. In my opinion, there are kind of these three big categories of face masks. The first one is your N95 and KN95 respirators. I'm going to talk more about what that means. And then we have the level 1 procedure mask, the blue one that everyone's wearing, and the reusable cloth mask. And so we're going to talk a little bit about the differences in those and what we suggest. Why do you wear a face mask? I saw this little graph on social media, so not Thomas, not us, but I saw this and it has stuck in my head, so I want to share it with you today. Why do you wear a face mask? And it's simply described as the urine test. If we all run around naked and someone pees, you're likely going to get wet. Now let's consider you are wearing pants and someone pees. Some will get it on you, but you might not get soaked like you would in the first situation. Now, if both of you have pants on, the urine is likely going to stay on that person and off of you. So a lot of people say, well, the mask isn't protecting me. It's not an N95, so I'm not going to wear it. It's not worth my time. I hope this image sticks with you. I hope you've learned something from this image about how those particles are spread. And so on this next slide, here's the difference between our masks. So N95 masks, you've heard a lot on the news about. Those do block 95% of the virus. We do want to keep N95 masks for our frontline workers, for our nurses and our doctors and everyone on the front lines. We do have a good alternative, which is the KN95. It is not FDA approved here in the US. It was for a short 2 months, and then it kind of came off the FDA approval, but it is approved overseas to block 95% of the particles. So if you're looking to protect yourself, I suggest a KN95 mask. Then, and Thomas Scientific has these. If you need them, you call your Thomas Scientific rep, we'll help you get them. After that, I suggest a single-use surgical mask, which is still blocking a lot of those virus and particles. And then, you're just kind of going around day to day or in your office, you decide cloth masks are the way to go. They're not blocking the virus, but in the previous slide, it will pass the urine test. And so I hope you take that with you today. I hope we can all laugh about how silly that is. But hopefully you think about that. When you see someone without a mask, maybe you think about the urine test. Up to you. All right, Vanessa.
Well, I know that the urine test definitely stuck with me, and this is kind of what we're coming to. These conversations can be really difficult to have with people, and I think as long as we kind of remember that we're in this a little bit all together and try to come, from a place of really good intention and have a good laugh with it, that these conversations can go a lot better for everybody. So hand washing, we definitely need to be doing, and then that's not always available. So hand sanitizers. You can do a single-use sanitizer. These are great to keep around you for when you're in a situation that you weren't anticipating touching something, and they look like little ketchup packets and you can toss them. Or you can do what I'm sure everyone's familiar with, bottles with the pumps, or larger ones that you can refill the smaller ones. And we really recommend having a hand sanitizer, at every desk, and keeping one in your car for when you get back in, and sanitizing down after whatever you just touched at the grocery store, and just keeping these around and available for everyone to have. And this is one of the situations where this market totally exploded and the product wasn't quite there. And this is why it's really important to read the label. Are you getting a hand sanitizer that kills viruses, or are you getting something that is just going to kill bacteria? So this is where the labels are really important. Sorry. The next part is the thermometers. And if you have had restaurants reopening around you, you may be familiar with them checking your temperature as you walk in. It would be important to provide, and I'm sure your employees would feel very good about having single-use thermometers in their homes, and then screening everybody as they come along through the screening kiosks if you have a large flow of people coming into work. And since we know that a fever is the most associated with it, it's really important to be monitoring the temperatures of everyone. We are doing back to work kits, and the idea here is really to welcome your employees back to a safe environment. And this is with face masks, thermometers, hand sanitizers, the alcohol wipes. These are really the important parts. And what we're interested in here is making your employees feel very comfortable. If you have field employees that don't come into the office, that stay out more often, you're going to want them to feel protected and have all the supplies that they need going forward. Social distance aids. These are things we're getting very familiar with and seeing. And this is just a great, loud, visual reminder for everyone coming through your facility to be aware of their distance to everyone else. And you're going to want to put these in places that are high traffic. So if there's a clock-in station, as Jen mentioned, you're going to want to pay attention to how are we touching to clock in? Do we have a hand sanitizer pump right next to it? But this is where you're going to want to keep people far away, especially as shifts are coming, shifts are ending. You're going to want to rethink your break rooms in this area. You're going to want to think if there's times when you have longer bathroom times than other times, and how to keep everybody spaced out through your facility. We do have a back to work safety brochure. My favorite part about it is the checklist for you to just go over things that you were thinking of, different resources that are available for you. And, you know, as Jen said before, and it's a great idea, if you're concerned about your safety returning to work, volunteer to be on that team. Take initiative to help protect yourself and to protect the other employees that you work with. And we're always here to help you come up with a better plan, to think about things maybe that you hadn't thought of before, and being really flexible in getting everybody protected and getting back to work. So if you have any questions, you're welcome to throw them into that chat. We're so glad that you joined us. We hope between dog food and urine tests that you've learned a little bit today that will be sticky for you.
Yeah. And we're going to have the brochure. I think that's going to be linked in our chat. Hopefully, I don't know if we want to load the info. Urine test, you can share it on Facebook, share it with your friends. I find it to be a very useful tool, and anyone who is against mask wearing or says masks are uncomfortable. Again, all of your Thomas reps, we've been in supply chain for the last 4 months supporting all of the COVID response teams and researchers working on vaccines and pharmaceuticals. And then now we want to help you get your employees back to work. We're all here to answer any questions you have. If you don't know who your Thomas rep is, you can drop a line in our comments section and we'll get you connected with the right Thomas rep.
We do have a question coming through about gloves for office workers. So if you're not used to wearing a glove regularly, I work in manufacturing spaces. That's a pretty standard thing for people to wear. Gloves don't feel good at all. And what we want to remember is that our hands have skin on them and our skin can feel. And if you're wearing gross gloves that feel gross on you all day, you'll get used to that feeling. If it's just your skin, you can feel when something sticky's gotten on your hands, or you can feel when your hands are dried out, or when they're sweaty. And so just be very aware of how you want to handle that. But even if you are wearing gloves, you do need to they have to stay sanitized. You have to switch them out under certain situations. So if you go that direction, just make sure there's a plan and some consistency.
I think we have a few more questions. Vicky asked, what was the kit called with the face masks? I think it's called our re-entry kit, back to work kit. We can drop a hyperlink to it, hopefully in our comments section below. And Andrew asked, do you anticipate a shortage of PPE, disinfectants, and cleaning supplies in the near future? And the answer is yes, and that's already happening. So one thing that we've been doing at Thomas Scientific is direct sourcing. And that can be a bigger conversation to have with your Thomas Scientific rep. A lot of things shifted. A lot of regular PPE products, the raw materials got moved over to make masks. So then there was a shortage over there. And then obviously the explosion of everyone needing to have disinfectants on hand. So it's very difficult to find a Clorox wipe. So these kind of things we are anticipating. And it's important that as you're making your re-entry plan that you are including someone like Jen or myself who are really
in the market. We talk about this every single day. We have our eye on the global climate because your job is ultimately to do your job at your workspace. And what we would hope to do is to take that level of responsibility off of you and give you the information and get you what you need. And then if something runs out, being able to have alternates for you. We've been doing that for the last several months, and I hope we're getting better at it. And it's definitely working to keep people in business and keep people protected. But we are aware of that, and we're going to work on it. And we do have great resources for you.
Yeah. I think the biggest thing, keep in contact with your Thomas rep. We're here to help you. I don't know if there are any other questions coming through, anything I haven't seen. If you do have questions, drop a line in our comments. We'll get it. We'll answer it. We'll connect you with the right person at Thomas to help you get what you need. So keep asking those hard questions. We love your feedback, so keep letting us know what you want to hear more about. And we hope that you have a safe 4th of July. And I personally hope you have a safe 4th of July with a mask on.
Thanks, everybody, for having us.
Thank you.